shoulder arthritis is definitely more rare than the knee or hip arthritis. I also think people can have shoulder arthritis, but since we're not walking on our hands, they're not as aware of it. But generally, it shows up with loss of motion and pain. And then, the x-rays are pretty straightforward. You don't need an MRI to tell if you have shoulder arthritis or not. It's basically a bone-on-bone situation. And what we're looking for in terms of deciding if and when someone needs a shoulder replacement is their pain level. Can we control the pain level with physical therapy or occasional cortisone shots? If that's not doing it and they're having severe night pain in particular, then probably that's the time to do a shoulder replacement. The other issue we try to be aware of is how much bone they have, because the shoulder is a smaller joint than the hip or the knee, and the socket part of the shoulder is really quite small. And if that bone wears away, it becomes much, much more difficult to do a shoulder replacement because you don't have sort of the bone stock to put the socket on. It is similar to, I would say, a hip replacement in that you're replacing a ball and you're resurfacing a socket, but the shoulder joint is not like a ball in a socket like the hip is. It's more like a golf ball sitting on a golf tee. So there's not a lot of bony restraint. So a shoulder replacement is in many ways a soft tissue operation. You're going in, you're doing a lot of releases, you're doing a lot of rebalancing. So in addition to the replacing of the parts, you're doing a lot more of that sort of surgery. Right now, it's an in-hospital operation. Most patients are in the hospital at least one night. A small percentage are there 2 to 3 nights. It's a longer recovery than either a knee or a hip because you have to go through the rotator cuff. So you have to repair the rotator cuff. So you have to let that heal. So there's the 6 weeks of being in a sling. As opposed to the hips now done, with the anterior approach hips, those patients are better in a couple of weeks. But unfortunately, with the shoulders, you still have to go through the cuff, repair that, let that heal. So that's all part of the procedure. So it does take longer. Most patients are far better than they were before the surgery. Most patients do not get back to like where they were when they were 20. We would like to see that happen, but it's doesn't happen that frequently because their tissue isn't as good. They usually have some rotator cuff disease. They usually do not have rotator cuff tears, but they do quite well. I'd say they're about 80%, most of them.